Well, hello, guys. You're listening to Beauty Bites with Dr. K, Secrets of a Plastic Surgeon. And today on the podcast, I'm very excited to teach you guys all about red light therapy. And I'm going to interview the founder of Biolight. So, Dr. Michael Belkowski, welcome.
Thanks for having me, Kay. Appreciate it.
Yeah, tell us a little bit about your background and what brought you into the red light world.
Sure. So I'm a practicing physical therapist. I have my own practice in Missoula, Montana, where I provide a variety of kind of unique treatments relative to physical therapy. So what I specialize in is dry needling, cupping, blood flow restriction training, and then earlier this year I added hyperbaric oxygen therapy. So really what I'm looking for is to provide any sort of treatment that will give my patients, the quickest results, real results. And so really that's where I stumbled upon red light therapy. Is I'm constantly reading. I'm just a voracious learner and reader. And so when I was looking through books, Amazon suggested this red light therapy book. So got it, read it, and the information was very interesting. A lot of parallels with dry needling in the sense that they both reduce inflammation and improve circulation. And if there's one thing I learned,
what dry needling is, I don't even know what that is.
Yeah. So I was just going to say the one thing I learned, if anything, from the dry needling course is that almost all pain, there's some sort of combination of too much inflammation, which is sensitizing the nerves, meaning it takes less of a stimulus to send a pain signal to your brain. So if we can reduce the inflammation and then quote unquote sensitize your nerves, then we can normalize the pain threshold. So and then same thing with circulation. If your muscles are too tight, your nerves aren't getting enough oxygen or blood flow, they're going to be more likely to send pain signals to your brain. So again, if we can reverse the inflammation and improve the circulation, we're going to get a lot of pain relief, for dry needling. Mm-hmm. And so dry needling is you use the exact same type of needles as you would with acupuncture, but the treatment philosophy is completely different. I guess from a treatment perspective, the needles go much deeper, compared to acupuncture. Acupuncture is quite superficial. Don't really go into the muscles much, I believe. Whereas with dry needling, I'll go all the way to the bone with almost every needle, which sounds terrible, but
it's not that
you're not gonna feel that much unless you have an issue. So if you have a healthy tissue and you don't really have any problems, sometimes you might not even feel the needle. But it's when your tissue's not healthy, you have a lot of inflammation or tight muscles, poor circulation, that you're going to get these intense, dull, achy sensations. But it's those dull, achy sensations that are telling your body that you need this and it's going to lead to relief. So again, this whole dry needling is what people really come to see me for my physical therapy practice. And reading about red light therapy, same mechanisms. You're reducing inflammation, you're improving circulation. So you're going to get all these amazing health benefits, but also on top of that, red light therapy is specifically stimulating your mitochondria. And also, what the research has, shown in the last 5 or so years is that our mitochondria, the health and the ability for it to function really determines our overall health and wellness and longevity. So if you have something as simple as light, red and near infrared light, that can optimize the health and functioning of your mitochondria, that's why it can lead to all these amazing benefits from hair health, skin health, athletic performance, sleep, reduce anxiety, depression, heart health, joint health, bone health. I mean, it goes on and on and on because there's literally mitochondria, thousands and thousands of mitochondria in every single cell of our body, except for red blood cells. So the point being, every one of our cells can benefit from red light therapy, outside of red blood cells, which is why it can lead to all these amazing benefits.
So literally it affects every single organ system in our body, as you said.
100%.
Yeah, so red light has been proven, scientifically proven, to improve hair health, to take dormant cells and wake them up and put them into active states. And it's great for your skin, it's great for sleep. So how does a consumer know exactly what type of red light therapy to get? Because you can go on Amazon and Alibaba and be sold like a red light face mask, which could be crap with the wrong wavelength of light or even damaging wavelengths. So how would you advise consumers, like, what's the right wavelength and how do you know you're getting it?
So currently the research is showing, the most optimal wavelengths in the red is 660 nanometers, near infrared is 850 nanometers. And so really all of the main companies, they've got that locked in, they've got the correct wavelengths. At the same time though, red is red, meaning as long as it's in the red spectrum, your mitochondria are going to respond to that. As long as it's in the near infrared spectrum, your mitochondria are going to respond to that. So while those wavelengths are probably the most optimal, you're likely going to benefit from anything necessitate near infrared, because red only treats the skin layer. It doesn't get deeper than the skin, whereas near infrared penetrates up to 2 inches into the body. The light irradiance is very important because if you're treating the bone or the joints or even the muscles, heart, any organs, you need something that's powerful enough to, penetrate deep enough to stimulate those cells and those organs. So the light irradiance is very important. Most of the main larger companies have above 100 milliwatts per centimeter squared. That's kind of the label there. Some of them are up to 125. Our newer devices are up to 150. So again, if you're closer, you're going to get better penetration depth, but again, it allows you to be farther away, allow the light to spread, so it makes your treatments more efficient if you're trying to do your whole body or just different spot treatments. And then secondly is kind of the safety specifications, which is paramount if you're going to invest in a health and wellness product. And so the two main ones that you want to look at for health or for safety would be the light flicker and then the EMF emission. So yeah, we can get into that quickly too if you want. Light flicker, as far as I've seen on the market, no other company's taken this into consideration. And just like you and I are looking onto our computer screens and all of us are looking on TVs and iPads and phones, all of these pieces of technology have a flicker rate, and it's so high that our naked eye can't perceive it, but our eyes and our brain can, at a very deep level. And a high flicker rate is bad for your eyes because over time it's going to cause eye strain. Just like people who work under fluorescent lights, you might even have that visible flicker, which is even more detrimental. But the light flicker is going to lead to eye strain and eye issues over time. And that's kind of the thing about light flicker is you might not perceive it right away. It's an insidious issue. It's not going to show up maybe for months or even years afterward. But again, the more you expose yourself to light flicker, the more likely you're going to give yourself eye strain, fatigue, and that's where it gets into the brain as headaches, migraines, and then even mood or behavioral disorders is shown with constant exposure to light flicker. So our pan, which is one flicker per second.
Say that one more time. I lost your audio. The audio broke up.
Which part?
You were about to say, so our light panel. But before you do that, we're going to get a quick Instagram video. So I'm just going to hold up.
Go for it, yeah.
Biolight. And we're podcasting this morning, learning all about Biolight and red light therapy. It feels amazing, but learn about the health benefits. I'm interviewing the founder of Biolight, Michael Belkowski. Cool. Did you want to get a shot with him and saying hi? Okay, say hey.
Hey guys, how's it going? Dr. Mike Belkowski here of Biolight.
Cool. Okay, so you were starting with, our panel.
Yeah, so our panels have a flicker rate of 1 hertz, which is 1 flicker per second. Most of the other devices on the market have 40 to 60 hertz up to 100 hertz. So you can imagine that much flicker per second is significantly higher than the 1 hertz that we have. So that's a big one to take into consideration. If you're looking to look on other websites, like you said, Alibaba or these other red light therapy companies, they don't even have light flicker listed in the specs because they probably haven't even taken it into consideration yet. And then another one is EMF emission, which most people may be familiar with from all the, Wi-Fi, Bluetooth, internet, cell phone, all that stuff, which is, again, we're inundating our bodies with this modern lifestyle, new technology, which is great, but it does come at a certain sacrifice to our bodies at the cellular level with all this EMF emission. And so it perplexed me that some of these, more popular red light therapy companies are integrating Bluetooth and Wi-Fi into their red light therapy panels. They have their own reasons, but it seems like, why would you integrate this, negative side effect for your body when you're trying to improve your health and wellness with this red and near infrared light.
Very true. So for the consumer, look for the wavelength of light, the flicker rate, does it emit EMF?
Yep.
And the credibility of the company, of course.
Yeah.
And with this device, for those of you listening, I'm holding my red light on my face right now. It feels very soothing, actually. When you turn it on, you almost feel like you're basking in the glow of the sun.
Yep.
It's quite bright. Would you be able to like hold this and do work, you think? sitting at my EMF emitting blue light computer with red light.
Well, that's a good point, actually. So when I'm working, if I have to be on my computer, especially at night, I will use the product you have, the Shine. I'll put it on the stand, and I'll put it right next to my laptop screen, and I'll have the light directed so it's not, right at my eyes, but it is going to negate the negative effects of blue light, especially at night, because blue light raises your cortisol levels, inhibits your melatonin production. So especially at night, that's not a good thing to be doing.
So the correct way to use your Biolight would be turn it on and kind of bask in the glow of it. How many times would you do that in a day, or for how many minutes is necessary to get the health benefits when you're using red light?
To get, just for general health and wellness, you only need to use it for about, 10 to 20 minutes. If you're really under the weather or recovering from an injury, maybe upwards of 30. I even have some customers that have told me they've used it, 45 minutes up to an hour if they're recovering from like a major surgery or injury. But in general, 10 to 20 minutes most days of the week, you're going to get overall, again, reduced inflammation, improved circulation, optimizing the health of the mitochondria. But if you're going for a specific benefit, like we've talked about, skin health versus, let's say, reducing anxiety, depression, those are two completely different protocols, which I think I sent you the ebook that I have developed, which is completely based off the current research. So for example,
amazing. That was very dense with research literature, and it's very, very good science behind it.
But just for example, comparing those two protocols, if you're going for anti-aging, reduced wrinkles, just overall skin health, improving, collagen and elastin production, you want red light only, because again, red light's not going to penetrate any deeper than the skin. It treats just the skin layer. You'd want that at about 12 to 18 inches away, and do that for 1 to 3 minutes. So very low dosage. Compare that to reducing anxiety, depression. You want near infrared only because it penetrates deeper. Put it up towards your skull. And the research shows that the right frontal lobe may be more beneficial. But then you want that at about 6 inches away. Do that for 7 to 10 minutes. So if you're going for those two different health and wellness benefits, you can see how the protocols can vary.
When you talk about like cancer and tumor cells growing faster in the presence of high oxygen, and I don't know, I just ask because I'm trying to learn for my own self, of course. But, any supplements that you think are essential? Are you doing turmeric, vitamin C?
Yeah, that's my big one, is like curcumin, and couple of supplements from Quicksilver that are kind of mitochondrial focused. So the big one is, one's like an AMP-K, and then one is called The One, which is for the mitochondria. So it has like resveratrol, quercetin, stuff like that.
And
what's another one I
take? Maybe.
Oh, astaxanthin's every single day. So those are the big ones. Yeah, the curcumin, astaxanthin. One with all these organs in it, like spleen, kidney, liver, heart, and then spirulina. Kind of like along the lines, there's actually research showing if humans consume more greens and so they're able to obtain more chlorophyll, you're actually able to capture more light energy, just like a plant.
Oh, really? Why eat the?
So it's like
why the organ one with the liver and the?
Because you're just getting all these micronutrients. Because even if you're eating a vegetable-rich or a plant-rich diet, especially with the soil, the modern-day soil, it's lacking so many of these micronutrients that stuff, especially like the liver and the spleen, are just very micronutrient dense that you can't get from eating even like pounds and pounds of vegetables every day. So it's just kind of a hack, and I got that from Ben Greenfield, if you're familiar with him. a
I
big
am going
proponent
to
of
interview him
eating organs.
Yeah.
Oh, nice. Yeah.
Interesting.
He
Yeah,
is an absolute wealth of knowledge.
that's cool. I love the idea of having spirulina and being more like a plant. Are you plant-based diet? Pretty much.
No, not necessarily. I've kind of gone through different iterations as I've read and learned. Years and years ago, I was really into keto. But then listening to Ben Greenfield and others, it's like that's not the end all be all. You kind of want to go in and out, seasonal eating, kind of eat with the seasons, eat with what's around you. Like, why would you eat a banana on December 21st if you can't grow? We can't grow bananas in Montana, so why would you eat it in the middle of December? Just it's a mismatch to the biology for where you live. So just eating with what's around you seasonally. Like I said, I'll do intermittent fasting, so 12 to 15 hours most days. I'll have a period where I don't eat.
How about hormonally? Are you doing anything in terms of like, women maintain, men are doing testosterone shots or HCG or other things like that?
No, I haven't gone to that point yet. Or like the peptide thing, there seems to be this big push on, peptides and injectables like that. But no, I mean, it all comes down to me for the light. And really, I've listened to 20, 40 hours of Jack Kruse. Again, Jack Kruse is the dots he connects through science and just through other things is amazing. So really, that's where I've gone to like minimalist supplements and adjuvants and like this external, I guess, need for things like that. Whereas again, the grounding, sunlight, CT, cryotherapy or cold thermogenesis, if you've got those things locked in, there's a less and less need for like these supplements or because if you do those things correctly, if you get your environment correct, your hormones and your inflammation and your mitochondria, they're going to be optimized where you shouldn't need that stuff, and you should be able to run on your endogenous systems. So that's kind of where I'm headed. It's kind of more of a minimalist, get the diet locked in, get the circadian rhythm and sleep locked in, but then get the light environment, grounding and water, and cold thermogenesis locked in. And I think the rest kind of takes care of itself in the long run.
Yeah, that's true. Maybe some rare earth minerals or anything like that. That might be good too. Rare earth minerals.
Yep.
And then blue light or EMF blockers. Are you into that?
Yeah, I actually have like some of these products. I forget what brand this is, but it's like a hologram chip thing where apparently this will protect me from EMFs within a 15-foot radius just because of what's the effect called?
Yeah, just the light scatter or the
it's supposed to kind of like scramble the EMFs and kind of match it with my frequency, if you will, instead of the EMF coming in and destroying it. So I have stuff like this around.
Who makes that one?
Shoot, what is it called? It doesn't even have it on here.
That's okay. I'm curious. I'm just curious.
I should know though. That makes me. I get emails from them all the time too. Let me see if I can find it.
If you find it, DM it to me. That would be awesome.
Yeah, I will.
Yeah. Would you ever do any kind of cosmetic treatment? Botox or fillers, or facial maintenance?
Man, I mean, it definitely wouldn't be at the top of my list. I have nothing against it, but it's just like, not right now, or I just don't know if I would have a need. It's not like I'm working in Hollywood or, I'm a model or anything where like I need to upkeep my face or whatever to that degree, but
it's
I'm not against it.
No matter how much we take in good nutrients and whatnot, we're going to get, facial atrophy from fat loss and muscle change. And osteoporosis and actually bone density change, I think, is a huge thing. I want to learn more about how the facial skeleton and the skeleton in general remodels.
November, December. So yeah, I'll definitely let you know when I'm in the neighborhood.
Okay, I love that. Stop by for sure.
Yeah,
we'll do a nice facial treatment.
I'll take you up on that.
Well, have a great day. It was really nice chatting with you.
You too, Kate. Have a great one.